Hi everyone, I am Dr.RUkmani. My today's topic is Intertrigo. So in this video, I'll be talking about Intertrigo. What is this condition? What are the symptoms? Who are at a higher risk, causes, diagnosis, everything. I will be talking about everything. So hopefully you have seen my previous video, that is like involuntary urination. So in that video, discussed in complication part Intertrigo. Intertrigo is a skin condition that is a reddish rash that appears on skin fold and usually on bigger folds like on your armpits or your groin area, breast fold. So these are the area, those are bigger folds, and you have like itchy pricky sensation in those rashes. So this can be primary as a condition itself, and this can be secondary, like this can be as a complication of other disease as discussed in the involuntary urination part. So this can be complication of like bacterial infection, yeast infection, and viral infection. Most important, is this condition a contagious one? Can you get it while touching the other person that is having this condition? No, this is not contagious one. You cannot get it by touching of the person who's having this problem. No, this is not contagious one. This is not. And then the causes and risk factors part. Who are at a higher risk and what are the causes? Causes, if it's like primary and the secondary one. Primary is the condition itself. Intertrigo develops when your bigger skin folds gets, they while rubbing each other, they are in the constant and friction, like when you rub your skin, fine. So while they are constant exposure of friction, there can be the rash formation, and this is usually found the person who are obese, overweight, and the person who's having diabetes, and as a complication of certain illness like urinary incontinence. We talk about the infection part. Yes, this can be the part of infection like secondary infection to the fungus like Candida albicans, and there is a bacterial infection, Staph aureus, and the viral infection. So this can be as a primary with friction, and this can be secondary. And then why these microorganism develops on these fold, on the bigger fold? What is the reason behind it? See, your fold has like the area is warm and the area is aerated, means there is no chances of having ventilation, almost the closed one, confined one, warmth, having moist. So these things are a better optimum medium for microorganism to proliferate, like for bacteria, for viruses, and most importantly for fungus. So this gives them optimum medium and they proliferate, and this causes the infection. So that's how you have Intertrigo as a primary itself with the friction, and can be secondary by certain infection. Sign-and-symptom part, like the condition is at times it is very discomfort one, the painful one. You have itchiness, you have like pricking sensation, you have painful, very discomfort, and very like pricky one. At times it is very sensitive and it is very painful. So these are the symptoms. And the sign part, in the primary, this can be symmetrical one, means if the condition is not caused by any infection, then this can be bilateral, means on the both side you can have the same way, like you're having one breast affected and the other breast affected, means your both breasts are affected. If it is a case of primary one, means there is no infection at all. And if it is a primary one, means there is no infection, then this is the limited one, means you don't have any severe symptom like any inflammation, any sign of inflammation, any smell discharge, nothing. You don't have much symptom, and usually it resolves on its own if you follow all the precautions. Means you are having cleanliness, you are drying the area properly, you are cleaning that area properly, so with time it gets resolved. On the other hand, if it is a secondary one, means you having this condition with the infection or by the infection, like with the bacterial infection, if it is a fungal or the viral one. So in these cases you have like severe form, you have inflammation, at times you have discharge, and at times it is very painful. And this is not bilateral one. If it is due to infection, this is not bilateral, means it is not necessary that your one breast is affected, so you must be having the other breast affected. No, it is not like that. Only one part is affected. one side of body can be affected, but other body part means you can have breast area affected and you can have thigh area affected, not the same area bilateral like. So this is unilateral in case of infection. Diagnosis part. Diagnosis means which test confirm this problem, or what other tests, what all tests are required. See, this is a skin condition and this can be primary or secondary. So if it is a secondary one, and if there is a doubt, so there are samples can be collected and that can be studied for the further type of infection purpose. So what kind of infection you are having, so treatment based on accordingly, based on that only. If there is a no symptom, that you don't have any major symptoms, so by looking or by physical examination, your treatment can be based on that. This is a in homeopathy diagnosis. It doesn't matter much that what is your diagnosis, it what matters is your symptom in homeopathy. Prevention is a very important step to discuss about for any disease. It is a very important part. If we discuss about risk factors that why you have this problem, so you should always focus on those factors that why you having this problem. Whether you are overweight, so just control your weight. If you are having diabetes, so just get it treated. Maintain your blood sugar level so that you don't have this problem in a severe form. Return, so yes, there are more chances. So just clean the affected area, just maintain dryness there, just clean that area, and you can apply talcum, and you can even use like cotton for physical barrier, right? And just avoid using tight clothing. Wear comfortable clothing so there is no like friction, no irritation, and you don't have this problem anymore. So you can do these things to prevent this condition. In allopathy, treatment is always based on the type of infection, what type of infection you are having, whether it is bacterial one, it is fungal one, or viral one. So you are provided like certain topical ointment, and yes, cleanliness is suggested. And so certain ointments, like if you're having fungal infection, then you are provided antifungal. In case of bacteria, you provided antibacterial. Same way, similar homeopathy, what matters is your symptom, your holistic approach. What symptom are you having? Yes, secondary one, your Intertrigo, or it is primary one. Means the disease itself is causing this problem, or you are having other infection, or you are having, means your holistic approach should be considered. So we are having certain medicine, but these are not the limited medicine. There are other medicine as well. It's always varied in homeopathy. If it is the medicine that is given when you have Intertrigo with the gelatinous gluey discharges, when you have sticky gluey discharge, in that case you can use graphitis, very good medicine. And these are oral medicine in the form of oral drops, not for the application purpose. So just use orally, and you can use even less quantity. Go with the lesser quantity. Why? Because your medicine gets changed with the time, with your follow-up. So just have graphites like 30 or 200 potency. Start always with the lower doses and just have 1 or 2 drops. Use it like twice or thrice in a day, and use it like 2 to 4 weeks till the time you start seeing difference. Right. And all medicines link are given in description box below. If you're watching on YouTube, you can buy medicine from there. You can start your treatment, but don't buy all the medicine. Just buy according to your case. And then petroleum is again a very good medicine in Intertrigo cases, where you have like sensitiveness. You are very sensitive. You are so sensitive that even the touch of cloths get aggravate your symptom. So in that case, you can use petroleum, 1 or 2 drops, same way like twice or thrice. Maxol is the medicine that is given in the extreme cases where you have like night aggravation, you have perspiration, you have offensiveness, and your problems are aggravated in night and warmth of the bed. So in that case, you can use Maxol. Salicia is given actually specific almost for Intertrigo. When you have Intertrigo in toes, means you're having your toes, and in between toes you have Intertrigo rash formation. So in that case, you can use Salicia, very good medicine. Causticum tops the chart almost, and Causticum is given when you have cracks. And yes, Causticum is a very good medicine even in old cases. So in that case, you can use medicine. You can like the color differ and the dose can be like potency can differ, but always check the medicine's main name. This video can help you. If you find this video knowledgeable, informative, please like and share. subscribe my channel, press the bell icon to get notified. Keep watching. Thank you for watching. Thank you for supporting. Thank you so much.